Hello, I'm Marilyn Hemingway, and welcome to A Gathering Place. I said, I'm stepping back because we have young voices who want to be heard and they're moving on something.
Branding is really important to you and your business.
Even a basic type of technology, you learn it all.
And people are
Good question. Good afternoon, everyone, and welcome to A Gathering Place, brought to you by the Gullah Geechee Chamber of Commerce. And I am your hostess, Marilyn Hemingway. And as always, every Wednesday and Sunday, we bring to you A Gathering Place, and we are happy to have you here at 4 o'clock. Thank you for joining us. And today we're talking COVID, and of course, we have our usual expert, Dr. Thaddeus John Bell, who's going to join us. And let me go ahead and bring Dr. Bell in. Dr. Bell, good afternoon.
How you doing, Marilyn?
I'm doing great. How are you doing?
I'm doing good. Doing good.
That's good.
Staying in and not getting out a whole lot. I've been in the whole weekend.
That's a good thing. That's a good thing. I cannot say that I did go out one time. But I am spending a lot of time at home, working and doing everything, which I hope most people are, because we are in, at a minimum, interesting times. And that's why we're here to talk about COVID and help our folks, get more education, especially now that we've had a change in administration, federal administration. The vaccine is rolling out. We'll talk about that a little bit, and what the implications are for the Black community, and the surging numbers, and what are we looking at there, and the variants of the COVID. That's a huge topic that we need to talk about. So there's a lot to talk about today, but first I want to do, before we get started, I'm going to put up some statistics for today. As of January 31st, total cases in the United States, 26,130,009 total cases of COVID in the United States, 440,652 deaths. That is of today, and that's staggering. That's just staggering. And in South Carolina, total cases as of about 2:15 p.m. today, total cases in South Carolina, 443,386 total cases, and total deaths are 7,042. And once again, those are just staggering numbers. Dr. Bell, I mean, I'm just blown away.
Yeah, I think in addition to that, I think I saw 26 people as of, is the day January the 29th? 31st, okay. Mm-hmm. So we've had over 26 or 27 people die over the weekend. And, before we go further though, Marilyn, I have been thinking about my very good friend, Winston McIver, a lot. And I just want to wish Winston and his family my sincere prayers. I know what Winston means to the community of the Low Country, an excellent practitioner, and one of my favorites on this program. And so I just want to let him, as well as his family, and well as the people that he served, know that he's on our minds.
He certainly is. He has been from the beginning of this, one of those stalwarts who just giving the information to the community, giving the information to everyone, and encouraging folks to do the right thing, wash their hands, social distancing. And but he was still serving his patients, and he has COVID now himself, and we have to do the right thing so that we can continue protecting our doctors, our frontline workers, so folks like you and Dr. McIver. So we do wish him the best, and
Absolutely.
we gonna claim good health for him, and I
Yeah,
know he'll come
well,
through.
I saw a recent thing on Facebook
Hmm.
within the past 24 hours saying that he is getting better, and it was kind of interesting. I read his comments very closely, and he mentioned that it has given him a different perspective. I know exactly what he means, Marilyn, because I've been there. I was real sick, not from COVID, but I was real sick, staring death right in the face. And as a physician and as a patient, it does give you a totally different perspective. So when Winston gets better, my first question to him would be, I want to hear more about that perspective. I want to see whether or not it's congruent with the one that I had. So anyway, all right. So with that being said, the question that Marilyn, I'm gonna start off with something funny. I think we
Okay.
need to hear something humorous.
Okay.
So yesterday, a friend of mine called me and he said, um, "I decided that I'm going over to the white community, and I'm gonna get in line behind a white woman, and I'm going to let her get her COVID shot first, and then I'm going to tell the nurse, give me my shot out of that same bottle that you just gave that white lady." And he said, then he'll know that he's doing just fine. Well, I thought about that because I think that that's where the African American community is, at least some of us, as it relates to our trust. Trust is still a major issue in our community. And it's interesting because, and I understand it, I understand all of the nuances that have come about as a result of 263 years of mistrust that African Americans have with the healthcare community. As I reflected on this, until COVID, a lot of our white brothers and sisters didn't really appreciate what we meant by that. They didn't really appreciate it. They didn't really know about the Tuskegee experiments and all of the other horrific things that have been done to the African American community, and more importantly, the effect that it has had on us until this pandemic. And now that we're in this pandemic, they're probably hearing more about why we have had such a mistrust in the medical profession that we've had ever in the history of medicine and Black people. And so, anyway, it puts us at a very difficult place because if you look at it very, very closely, our mistrust, if it continues at the level that it's continuing, can be detrimental to our final outcome as a people. Does that make sense? Does that kind of make sense?
It makes sense. And being a Black person in America, we are actually a living contradiction because every day we're asked to trust the system that oppresses us.
Right.
And white people don't understand it. They don't understand. And it takes, what is it? Is it the state of Missouri that says, I'm the show me state?
That's exactly right.
In the Black community, we the show me community.
That's exactly right.
And there's two things I want to say very quickly. Regarding Dr. McIver, I too would like to talk to him because he has now not only the clinical perspective, but the personal perspective of having COVID.
Right.
And then the second point I want to bring up is we have Dr. Fauci is out here talking about the importance of the Black community getting vaccinated. MUSC, I'm after we finish, I've been writing an invitation all day. I've been so busy asking Dr. Marvella Ford and her group to come on to the show. I'll let you know about that too when they can come on.
I'm not a member of the faculty, but I was on those calls. So
Okay.
just so that you know, yeah, they did write a very fine letter that they sent out to the community. And the bottom line was they endorsed the COVID vaccine. But she would be an excellent person.
And I would
for
love for you to come on if they could come on to the show. But it's good that they wrote a letter. We are hearing that we need to go get the vaccine. I understand that. What we are not seeing is how do we get the vaccine? When I pick up the phone, what number do I call? What hospital do I call where I live? Where am I on the list? Explain the list to me, how this is going to work. You must show me the phone number for me to call to make arrangements. And when I go, you can't play games. You got to make sure when I show up that I get the vaccine. You can't turn me away. So for the Black community, we are the show me community because we have mistrust in the system that was built to oppress us, but we also have to rely on that system to save us. So as a Black person in the United States, we are living contradictions. So that means you got to meet me where I am. And yes, it takes more investment of time and money to do that, but guess what? I'm worth that. Black people, we worth that. That's Black Lives Matter. Yeah, put the money in, put the time in. I was interviewed by Channel 15 WPDE yesterday, I believe, or the day before, and they had a show. That was the question. And they interviewed a friend of mine, an elderly Black woman, Miss Viola Holmes Green. And she was just talking about, she knew she needed to get that vaccine. She wanted the vaccine, but she couldn't get through the phone number. She couldn't get to the point where she could get the vaccine. And she really had to work the system to get to that vaccine. And she did get the vaccine. But what she had to go through to get to it, you could tell on the passion she had when they interviewed her on the news, that, that was a really upsetting experience. And then when she got there, she saw 3 people that looked like her getting the vaccine. And the rest of the people didn't look like us. So this trust thing is more than just saying Black people get vaccine, because that's you putting the responsibility on us. No, you got to show me. You got to come into my neighborhood and open up a mobile vaccination center or something, but you got to come to where the people are. And I just wanted to say that, kind of set up what we're talking about, Dr. Bell. And I know you know this and all, but your thoughts, please share with me.
Well, your concern is absolutely on point. One of the things that I want to let the audience know is that the people who were responsible for setting up the process as to how we were going to get testing done as well as vaccinations done was DHEC. Okay, so I gotta say to you that DHEC has left a lot to be desired with reference to their thought process in considering communities of color as to how that vaccine was going to be disseminated. To my way of thinking, they have made some of the same mistakes that they made when the testing was rolled out. And it continues to be documented. It was just documented a week ago that South Carolina was one of the worst states in the nation as far as vaccinations were concerned. In other words, we were getting, even after we got the vaccinations, we were at the bottom of the list with getting the vaccinations into people's arms. And so I can tell you right now, because I'm connected with I'm on the board of AARP, and there are going to be, starting tomorrow, some very interesting discussions from people like AARP and other people about the ill effect that DHAC has rolled out to make sure that people of color get the vaccine. Now, to your point, it appears as though, in order to be able to, if you have some good computer skills, if you have good internet skills, if you are going to be sitting at your computer and making sure that you are putting in the right information on a regular basis, you will be able to, in many cases, override the system that was supposed to be in place to make sure that the vaccine was going to be equitably given. We already know that. And we already know that just based on the 2 weeks that has already gone by, that communities of color are coming up short when it comes to getting the vaccine, particularly the rural community. You and I alluded to this a week or two ago, but we are finding out that communities of color, the bottom line. And here's the other interesting thing that I need to let people know. I've always been a proponent of having more African American physicians in the healthcare profession. Well, if we only represent about less than 7% of the healthcare professionals in South Carolina, a whole lot of folk who we take care of African American descent is not going to get good information. All right, because there aren't enough African American doctors, Hispanic doctors, Native American doctors to take care of the people of color in South Carolina. We make up about 35% of the population of South Carolina. Yet the data shows that we are not getting this vaccine at the rate that our white counterparts are getting it. And so it is creating a significant problem. I'm hoping that DHAC is going to go back and look at it again and come up with a better way to make sure that the vaccine is going to be distributed equitably. Because we already know that members of the white community are already coming into places that were designated for African Americans to get the vaccine. And because of their computer skills and et cetera, they are being successful at making that happen. So we want to make sure that everybody gets the vaccine equitably. And we want to make sure that certainly the communities of color are not left out again when it comes to doing the right thing.
Yeah, what you just said about white folks coming into Black communities, I just saw today on the news, and it's not in South Carolina, but I must say there was a rumor in Georgetown, and I haven't had time to follow up, that in the Black community where they have a vaccine center, they saw more whites they've ever seen in that neighborhood. And today I was just reading it's saying, I think it was in New York or someplace with Washington Heights, that's a Black and brown, Hispanic and Black neighborhood. They have never seen so many white people in that neighborhood. And it's actually cutting out folks from getting vaccines who live literally right there in the neighborhood where they have the center.
Right.
And it's such a glaring example of the health disparities in action. I mean, it's a health disparity in action that we don't have access to know where to go, the information. Lack of access to computers is a problem. So
one of the things that I learned, one of the things, Marilyn, that I learned very early during the time that I was director of diversity at the medical university back in the 90s. Okay. If you don't have black people at the table looking at black people's interests, you're going to get left out.
Mm-hmm.
I can tell you some stories, some things that would have gone totally wrong if I were not in the room and willing to speak up and to literally say, well, what about us? You haven't considered us, and then have the thing change. So it's very, very important when these committees are put together. I would be interested to find out how many black people did they have sitting at the table to make sure our interest was going to be taken care of. And not only just people of color, but just poor people in general. Because, you know, white people are poor too.
Mm-hmm.
Just poor people in general, to make sure that our interest is going to be taken care of. So we are hoping that after they reconsider how the distribution is going to be done, and even how the testing is going to be done, because the two things go hand in hand. We're going to continue seeing the number of cases and death in our state rise to another level.
Now they're talking over 500,000, I believe, by the end of April, dead in the United States. And that I just saw that briefly this morning, I believe, and haven't delved into it, didn't have time to delve into it. And this is real. I mean, we're talking about we're at war, and I'm not at the point. We just know we need to make a serious course correction. I think we have an administration, thank goodness now, that takes the science seriously, and they are displaying in real time that they're taking this seriously. And folks, this is important to notice that, because I think there are 500 people who work in the White House, but 80% of them are working at home. When they have meetings, they limit in the I was reading about this, like 10 in the conference room. You can only meet with your direct report, and you have to schedule that meeting. You notice in press conferences, they wear face masks, they distance, they're seating the reporters, social distancing. They must display the behavior that they want the citizens to do. So I feel better on that level that our government is taking it seriously. Now we have to work together to make sure that seriousness filters out to the bureaucracy, and it filters out to the states, because I think people have in their head, that's not my problem. It's those poor people problem. And what they don't realize, we have working poor people in the United States. And those working poor people drive the buses, drive the school buses, clean the hospitals. They're in touch with us. The essential workers are in touch with us. And if they don't have the vaccination, if they are not protected, we're not protected. I don't care. You can only go but so far away from other people. It's going to catch up with you. And I'm going to allow this to segue into the variant that we're seeing of the COVID now, because the two cases in South Carolina that are the South African variant of the COVID, these folks did not travel. They didn't travel out of the United States. So how did the COVID, did it mutate in South Carolina and become the South African variant? Or did somebody touch somebody, touch somebody, touch somebody, that eventually it touched these two people in South Carolina and it became the South African variant? Because now tell us about the variant, Dr. Bell. I understand it transmits faster, and it's more, I don't want to say dangerous, but the impact is greater than the regular COVID.
You're absolutely right. Well, we do have You know, it was kind of interesting because last week, South Carolina didn't have any variants. And then day before yesterday, it was announced that South Carolina has two variants that have been found, a patient in Charleston, South Carolina, as well as a patient in Greenville, South Carolina. The variants that are coming to our attention are the variants from South Africa, the United Kingdom, and Brazil. The two that have been found in our state has been primarily South Africa. You're exactly right. These patients, when they did a history, had not found to be traveling at all. So the variant then came as a result of the mutation that was already in the state. And that's the way they think that the variants are going to occur. They're already in the virus is already in the state, and in an effort for the virus to survive, it will mutate and become more contagious and will also spread as quickly. And so that's why it is felt that if we don't get the vaccine out as quickly and to as many people as we need to get it out to, the variant that we are currently seeing is going to overwhelm the regular COVID that we are already seeing in our state. So that's why it's important for us to get the vaccine into as many arms as we possibly can. The concern is, will the vaccine that has been approved by the FDA, the Pfizer vaccine and the Moderna vaccine, and I will mention the J&A because it hasn't been approved yet, but when it does get to be approved, it's going to take us to another level, but it hasn't been approved yet. But it is felt like the two vaccines that have been approved, to date, it is thought that the vaccine that you're currently getting will protect you against the new variant. That's what the information is saying today. But I need to remind people that the information is rapidly changing. And when I come back on here again, within another week or two, I may be giving you some entirely different information. But today, we feel that the vaccine that you're currently getting. Now, if we can, let's just mention something about the J&A, Johnson & Johnson. That vaccine will protect, it's going to be 66% effective. We have gotten kind of spoiled because we are talking about, well, I want the 95% protection. I need to remind people that we've never had a vaccine in the history of vaccines other than the measles, mumps, and rubella that has been 95% effective. The vaccine that you've been getting for the flu is in fact about 66% effective. But the reason that the Johnson & Johnson people are saying that that's the case because they did their clinical trials in a different group of people than Moderna and Pfizer did. And so based on the people that they did their test on, it was 66% effective and it only required one shot. But as time progressed, it very well may be that the Johnson & Johnson vaccine will be just as good. I would recommend to people, and this is what the experts, Dr. Fauci and the experts are saying, that when the Johnson & Johnson vaccine gets approved and it becomes available, get it. Don't wait around saying that you're going to get the Maduro, or that you are going to get the other one, the Pfizer. Get the Johnson and Johnson, because the amount of protection that it will give you will be much better than not getting anything if the other two are not available. So when it becomes available, get it. That's what I need to tell people. And the other thing is, it will probably be more accessible because it won't require as much packaging. You can keep it in the refrigerator. It won't be as unstable as the other two that we are dealing with. So it does have some advantages when it becomes available to our community.
That's good to know, Dr. Bell. I want to go back to the variant for a minute so to make sure people understand. And I think I understand because this is a new term, I think, out there for folks, to really regular folks like me. So when we talk about variant, are we talking about a situation, for example, I'm going to use the flu, but I want people to understand COVID is not the flu. It's worse, okay? But I want to use so we get the flu. We know every fall, winter, the flu is going to come around. But we have to get a new shot every year because the flu mutates. So when we say variant, we get a new variant of the flu each year that we have to prepare for.
Marilyn, that's an excellent way of thinking about it. Okay. Every year, the flu shot is given. It's not the same as it was last year. Based on what the people got down under in Australia, the scientists now know that that virus that folk got down in Australia is probably going to be the same one that's going to be gotten in America. So they have to tweak the flu shot in able to accommodate the new virus that we are going to be seeing. So just think of the variant, a simple way of thinking of the variant, just think of the variant as a mutation. The virus is trying to figure out a way in which it can continue doing its bidding, and that is taking people's lives. So it's going to change. And so when it changes, we are going to need to change. And of course, I was just reading today that if it does change, the scientists from Pfizer and Maduro are thinking that the vaccine that they already have will just need to be tweaked just a little bit to accommodate the change that the virus is going to make. So I feel good that the vaccine that we're currently that's currently available to us is going to offer us some protection. The issue is getting it into arms. That's the issue.
I want to remind everyone before we move on that you are watching A Gathering Place brought to you by the Gullah Geechee Chamber of Commerce, and we welcome everyone today. And if you have any questions about COVID-19, the vaccine variant, whatever is on your mind, we have Dr. Bell with us for a little while longer, and we want to get those questions in and any comments answered for you folks. And I must say, we are kind of diving into the weeds, but I also think that speaks to the science that we need to understand and understand very quickly of what's happening. And I do feel better, Dr. Bell, that we have an administration that's taking the science seriously. And I think a year ago, as they started learning more, Dr. Fauci kind of warned us about this, that we need to get this under control because they were afraid that it would start mutating and they would have to adjust to that. And if you're already behind, it just makes it harder to adjust. But you can see the difference with these, now that we have a vaccine, and now you are recognizing mutations that you can make those tweaks to get into the arms. But it's important that we get that vaccine into arms because that allows us to achieve herd immunity faster.
Right.
And as you were talking about the 66% effectiveness, etc., and I was thinking about herd immunity, that's why it's so important. The more of us who do get the vaccine, that actually kicks in herd immunity and protects those who can't take the vaccine. Because there have always been people who can't take the vaccine for health reasons and other reasons.
You're absolutely right. There's one
ahead.
other point that I want to go back and make that you made, and that point is this: the Biden administration is very diverse. So the likelihood that the concerns of a diverse country is not going to come to bear is decreased, because the people that he has at the top are diverse. And if they do their jobs, they're going to bring in the concerns of their community. I remember, Marilyn, I worked for Dr. Jim Edwards, who I adored, very, very fine man. And I never shall forget, he had a president's council that met every week. And I noticed that it was just 10 of the most influential people at the medical university on the president's council that didn't have no black people on there. So I had just been named a director of diversity. So I went to his office and I said, "Listen, Jim," I said, "why am I not on that committee?" He said, "Well, why do you need to be on that committee?" I said, "Because you got 10 white people on the committee that all think like you do. I'm African American. I don't think like those 10 people do. Now, you all may not take my advice, but at least you will know the concerns of the black people that work at this university and the black people that we serve." So he said, "Well, let me think about that." And so the next day, he named me to that committee, which I served on for the duration of my tenure as diversity director. So I say that to say again that it's important for us, for black people, people of color, to be at the table, because when we are not at the table, our concerns do not get addressed.
That's right. That's right. And I mean, I know you're the medical person. I'm more of the political person, but it's a politics is in everything. You just prove politics is in everything. And politics means you negotiate to be at the table.
That's exactly right.
Care for your community. And this is why it's important we get involved. Go ahead, Dr. Bell.
I want to tell you about a new symptom of COVID that I'm finding to be very interesting. And it's called the COVID tongue. Have you heard about that?
No, what? No, have not.
There are patients who are presenting with what is referred to as the COVID tongue. The COVID tongue gets to be very, very large, red and beefy, sometimes can have splotches on it, sometimes can be very, very painful. And it's just another presentation of the COVID infection, just like people can have COVID toes. Are you familiar with COVID toes?
Now, I've heard of the toes, but I haven't heard of the tongue.
Yeah, so COVID tongue. So this is just another sign that we are seeing with patients. Their tongues can get sore, can get beefy red, and oftentimes this will be the presenting symptom with reference to the COVID infection. It is not very common, but doctors are beginning to see it more frequently as we are seeing more people affected with COVID. So I just thought that was an interesting side note. We always interested in giving out new information in these kinds of forums.
So I'm glad you mentioned that, Dr. Bell. What about we have a question. Does the tongue swelling impair breathing? That's a good question.
That's an excellent question, because when the tongue begins to swell, that means that you shouldn't wait until it goes down. You should go to the emergency room at that point in time. Because if the tongue swells up big enough, it can obstruct your airway and you can die from asphyxiation from a swollen tongue. So one of the things that and that leads me to think about something else that I like to tell our audience. I've seen over this past week, 3 of my patients who have called me with classic signs of COVID. And I have recommended that they go to the emergency room, and they have resisted. One of the patients ended up eventually going and had to be admitted to ICU right after he got there. And I'm just trying to figure out what goes through a person's mind when they call the doctor and the doctor tells them, look, go to the emergency room, and they say, no, I think I'm going to be all right. I'm going to stay home just a little bit longer. And that's one of the, that comes under personal responsibility. If you don't take the doctor's advice, now I understand why you may not want to go because you don't want to be diagnosed with COVID. But there's an old saying that one of my professors told me, when you hear hoofbeats, think of horses, not zebras. Okay, so when you got COVID symptoms, I want you to keep in mind that you need to go to the doctor, particularly if you have pre-existing conditions. If you have pre-existing conditions, go to the emergency room. Let them tell you to go back home. But don't you make the decision on your own, because we are now finding out that there are a lot of African Americans and people of color who made that decision and they found it home dead from COVID because they did not follow through with what the healthcare professional recommended. So that's very important to remember.
Thank you, Dr. Bell. And it's a good question. So thank you for asking that question. We have someone here who said they just received their first shot yesterday. To protect myself and my community, need representation from the communities that are served. And that's so true. And that's what Dr. Bell and we've been talking about that, I think, for the past 3 appearances, Dr. Bell, that we need to step up because it represents our community and protects our community. So
right. And Marilyn, this is why it is important for doctors of color, as well as white physicians, to encourage African Americans to take the vaccine. One of the things I have to remind people that most Black people are taking care of by white folks. It ain't enough Black doctors to take care of all the Black people in South Carolina. So most folk who are listening to me are not being taken care of by people who look like me. So I hope that you will have some trust in your physician to ask him to convince you or to take a little time to tell you about the COVID vaccine. The other thing I want to remind people is that not only are we going to have to depend upon our healthcare professionals, but we're going to have to depend on other people that people of color have a trust in, and that would be our pastors and our religious leaders in our community. And then also people who we have elected to public office. If they're people of color, they should have a working understanding of why you should take the COVID vaccine. So between those three people, your Black doctor, your pastor, your political figure, or people who you trust, but please do not get your information from folk who don't know what the hell they're talking about. I'm telling you, I cannot tell you the amount of BS that I have to deal with every day from folk calling me up, telling me, well, my cousin said, And I'm saying, well, how many people does your cousin take care of? And doesn't your cousin have COVID? Well, if they knew so much, why did they get COVID? Don't get me started on.
I understand, but we need to check multiple sources. We start with the news. We start DHEC that has not been perfect. We know that, but we know in general they're paid to be experts. But check multiple sources. Check your news. The reliable institutions. And my thing is, though, we've got to tell people this is where you go get the vaccine. This is how you get the vaccine. Call this number. I think that's a missing piece to this. And it leads to this question. When are primary care physicians going to start administering the COVID-19 vaccination? Musa, very good question. Thank you.
I know that person. And his question is on point because the vaccine has not been dispensed to physicians to be able to give out. Okay, that has not happened. I don't know whether or not it has even been considered. I certainly would consider it. All right, and that's something that DHEC really does need to consider. But they were not a part of the structure that was to be used to dispense the vaccine. But all of that with the new administration may change. I want to acknowledge and give a shout out, Marilyn, to the Federal Network for doing an outstanding job for making sure the COVID vaccine is distributed to communities to people of color as well as other communities. They are doing an outstanding job, and I just want to make sure that
they are.
Yeah.
I just shared on our Twitter account information from FEDER that they were having a clinic, I believe, in Berkeley County. Coming up. So,
so a lot of people have never heard of FEDER until this right here, but they are out front and doing a phenomenal job. By the way, it's a federally funded health center, and I think that people should go to their network because they're just all over the place, and they're making sure that people of color and as well as other people, poor people, anybody, get the vaccine. So check out their website to get additional information.
And I should know that. Well, federhealthcare.org, y'all. I know that website.
I should know it. I should know it too, Marilyn. I should know it too.
Yeah, we know that website. Y'all check out FEDER and find out. They'll be very helpful. They really have been out front regarding testing and the vaccine. So federhealthcare.org. You guys get the phone number, call them, and get more information. Let's talk about this Swiss cheese process here that you and I were talking about. I do want to, let me put this one up first to remind everybody, how can you protect yourself against COVID-19? Wash your hands frequently. And let's emphasize, this is stuff that is still, even with the vaccine and after the vaccine rolls out, we should continue to do. Wash your hands frequently. Avoid touching your eyes, nose, and mouth. Avoid crowded places and put space between yourself and others, 6 feet or more. Cough or sneeze into your bent elbow or a tissue. And if you have a fever, cough, or difficulty breathing, seek care early. And Dr. Bell's already talked about that. Call beforehand and follow medical advice, y'all. All of these things that you've been hearing starting a year ago, when this first was brought to our attention, they still apply. And even after the vaccine, they will continue to apply. The vaccine is not a magic elixir. It's to get us to herd immunity to protect us. But what's even more important, wear that mask, wash your hands, social distance. And that leads us to the Swiss cheese COVID process. I'm going to put this up here, and you can
And,
explain.
and while you're putting it up, I just want to remind people that even after you get the vaccine, you need to continue wearing your mask. Now, since we are talking about masks, there has been a plethora of information out about whether or not you should double mask a single mask. And the experts, most of the experts that I'm listening to, and most of the things that I have read about, they are saying now that you can give yourself even better protection if you double mask. If you double mask. But the most important thing is put on the first mask and make sure that you wear the first mask correctly, because we still see a lot of people with the mask down below their nose. And the other thing I want to mention is that I think the federal government now has mandated that in all federal buildings and in all federal transportations and et cetera, you will have to wear a mask, a facial protection. It's going to be against the law. Now, I just want to kind of, I'm glad you put this up. This is what we call the Swiss cheese model, and it shows you, and it will continue to be used even after you have gotten the vaccine. But you notice that you gotta wear your mask. Now, I want you to take a look at social distancing. I'm finding out that in our community, Maryland, a lot of people are getting COVID because from their friends and family, because people are not being honest with them that they were found to be positive, and they are coming into people's space, and they're not, when you come into somebody's space and you've been told that you are COVID, that you have been exposed to someone, you have to quarantine yourself. Because if you don't quarantine yourself, even though you don't have symptoms, you can affect other people. And I'm finding, Marilyn, that a lot of elderly people have gone on to judgment because people came in their space knowing they had been exposed, did not do the necessary things to protect their family and their elderly people. And so I'm finding out that particularly in the African American community, this is happening a lot. So social distancing is very, very important. The other thing I want to make you aware of is that we are finding that the places where African Americans seem to be getting the COVID from when they're not social distancing is in bars, at funerals, at weddings, at church, and at parties. So you definitely want to quarantine and practice social distancing and be in areas that are well ventilated, and try not to be, if you're around a lot of people, you don't want to be around a lot of people a long time. More than 15 minutes really puts you at risk. So that's what I wanted to make sure that we put on, to be able to give people some working information. And by the way, I always tell folk, a lot of things that I'm telling you is not printed as it relates to Black folk, okay? But I need to tell people that, I've been taking care of Black people for about 45 years. And so there are things that I picked up on over the years that I can tell you about our behavior that the majority community may not tell you because they don't know and they don't feel comfortable talking about. But if you remember, Marilyn, I told you a couple of months ago that I thought contact tracing in our community was going to be an issue. And it is an issue.
And it's an issue probably because people are not admitting what they're doing. They don't want to know. They don't want to tell their business. But I know of an instance of a birthday party with kids. And the kids, I saw the pictures and I was like, boy, that's not good. And sure
Yeah.
enough, about a week later, I was hearing about COVID from that party.
Yeah.
And people were not thinking. And then when we put ourselves in these situations, we're not admitting that we've put ourselves in that situation. That's not helping you, and that's not helping your family and friends. I cannot tell you how many people, elderly folks, I've been told, got exposed because they were at a funeral or they had a birthday party or some circumstance where it was a crowd in a small space.
That's
and it
right.
only takes one person to spread it. And I understand, I went through it because, we buried my father in August 2020. And I told, even when they were visiting my brothers and his grandkids came to see him because he died of cancer, we knew he was dying. And they would walk in the door and I had the mask ready. I would spray them with Lysol and they had to wash their hands. And then when he passed and everybody came back home, they were like, Aunt Marilyn's going to spray you at the door. And I wasn't kidding. I said, we're going to wear masks. We're going to wear them in the house. And there were one or two of my family members, I could tell they weren't taking it seriously. But I was adamant. I told, I'm not going to get sick because you don't know who has it. And some of my family members were tested before they came back home, but not all of them. And I can say from the funeral, everybody was masked. It was outside. And it was shorter than usual funeral. Our Black folks, we like our funerals, our long funerals. It was shorter, and we were very adamant about certain things. And as far as I know, no one got sick from the funeral. So you can still have your funerals, but we just gonna have to change our behavior, and we're gonna have to be honest with each other about where we've been and what we've done. Mm-hmm.
You're absolutely right about that. I've heard some of my patients talk about people that they know where 3 and 4 people in the same family have died within 24 to 48 hours of one another. And when you investigate the history, someone came into their space and infected the entire family. Mm-hmm. And as a result, the entire family either got sick and many of the family members passed away. So I just want to make sure that, you ask listen, during this period of time, you got to ask the right questions and don't feel embarrassed about it. And if you're not sure, you got to get from around people who you think may not be healthy for you to be around as a result of COVID. And then, Marilyn, before we go, I want to make sure that we do not forget to tell people to continue getting tested. Continue getting tested, because that is a way testing and vaccines and doing all of the things that we know we should be doing is the way that we are going to get out of this pandemic. It continues to affect African Americans at a disproportional rate than other groups of people. And I cannot overemphasize that.
Very good. Thank you, Dr. Bell. And I think that's a good point to end the show because we're there. You got good timing.
The time goes by fast. I tell you what.
Does. We really, really drilled down, but it was good information that folks need to know. And I want to thank everyone for joining us on A Gathering Place, because this is why we gather, to share this type of information for our community, our health, to protect ourselves and also to grow economically. That's what we have. Lots of people who come on, and Dr. Bell is a regular. So we want to encourage everyone to please donate to his foundation. And I'm going to try to pull that up, Dr. Bell. Oh, we got a thank you here.
Closing the gap in healthcare.org. And I want to remind people that, for us to be on radio and television, I don't get paid for doing that. I have to pay to be on radio and television. And so when you make a contribution to closing the gap in healthcare, by the way, we are a 501c organization, and you can check us out. Our record is good and our record is clean. And
Very good.
we appreciate you. Thank you very much, Marilyn.
Thank you, Dr. Bell, as always, and we'll see you next time. We'll bring it back on, but I know there'll be more information.
Absolutely. You take care.
All right, you too. Thank you. Well, everyone, as usual, Dr. Bell brought us some wonderful information, and we want to thank you also for joining us today on well, thank you. Thank you, Mayor McClary. Always good to hear from you also, and glad you appreciated the conversation. It's always good to bring Dr. Bell on and get information about COVID and also disparities in healthcare in the Black community. I want to remind everyone that we do this semi-weekly every Wednesday and Sunday at 4 o'clock, and you are always welcome to join us. And on First Friday, we do We Network, and We Network is our First Friday networking event. This is going to be on our Facebook page, so you come on and join us on our Facebook page and sign up to present your business, product, and service. And if you just want a referral, if you have a need out there, you can join us and ask for example grant writers. The last week I've had folks calling me, emailing me about grant writers. Do I know any grant writers? So I was able to make those referrals. So if there's some service you need out there, a product you're looking for, come on We Network on the first Friday of February, the 5th at 6 o'clock, and it'll be on our Facebook page, and you can sign up there to come on, or watch us on Facebook Live and YouTube Live, and send us in your comments any questions you may have. Always enjoy having everyone with us on Sundays at 4 o'clock. Thank you once again, and thank you everybody for joining us, and have a wonderful day.